This is GovExec Daily, the show that gives you the federal stories that really matter. It's November 30th, 2022. I'm Adam Butler. The pandemic created a massive shift in the way Americans think of mental health. For many, the fear of catching a dangerous virus created a level of anxiety that was previously unheard of. As a result, many federal agencies and employers across the country were forced to adjust. Now remote work is the norm for many employers. But the work doesn't stop there. Mental health is complex, and it looks different for each individual. So as a manager, what steps should you take to adjust? If an employee is requesting time off or is simply asking for help, what's the process? David Barron is a labor and employment attorney at Cozen O'Connor. He joins us next to discuss how employees can request reasonable accommodations and how employers can offer support to employees in need.
Want to hear more from GovExec, NextGov, Defense One, and Route 50? Tune in to our virtual events to hear interviews with government leaders about the most important topics today, including the federal workforce, health IT, artificial intelligence, 5G, and more. Visit govexec.com/events to learn more.
Mental health is complex and looks different for each individual. So as a manager, what steps should you take to adjust? If an employee is requesting time off or simply asking for help, what's the process? Especially now that the pandemic has changed everything. David Barron is a labor and employment attorney at Cozen O'Connor. He joins us now to discuss how employees can request reasonable accommodations and how employers can offer support to employees in need. David, welcome to the show.
Thanks. Nice to be here.
Awesome, man. So mental health is something that is really important to me. I like covering these subjects. And, since we've been in a pandemic and the world has really shifted, and honestly, the conversation around mental health has become more transparent, more mature. People are more accepting to things. But that doesn't mean that it always translates to the workplace. There's always this kind of idea that like you have to do your work. You have to, battle through no matter what. Let me start off by asking you, if you are an employee, right, and you feel like you're having troubles in regards to mental health, what do you feel like are requests for reasonable accommodations that should be offered to you?
Yeah, so of course that's going to be individualized based on the person's specific issues, right? But most organizations have a process, usually through HR, usually not with your direct manager, although they may get involved, where an employee could ask for some help, right? Like I'm a lawyer and I'm going to use, fancy legal words, but basically it's if an employee needs help, most organizations have a system or a process set up for that employee to reach out and get help from the employer. That could mean time off. Mm-hmm. It could mean, look, I'm going through a really tough time. Maybe a loved one died. Maybe there's some sort of stress in their life that's creating a mental health issue that's temporary in nature, where that person just needs, a couple weeks to collect themselves. Maybe it's an ongoing thing. Maybe it's adjusting to a new prescription. I mean, it could be any number of things, right? It could be changes to jobs. So really in my world of employment law, anything could be a reasonable accommodation. It's just a matter of, is it in their workplace reasonable? And it could change from big organizations, small organizations, geography, what's your job? If you say, I need to be able to take a lot of breaks or something, well, maybe their job doesn't allow that, right? Yeah. So it's going to be kind of particularized to that person's job.
Yeah, and so let's take this to a management level then, because I imagine there's a lot of changes, and I know you're going to speak from a legal aspect, but even just in your opinion, I imagine there's been a lot of changes to what managers have to deal with, right? Now that we know more, you mentioned people wanting to take a lot of breaks, probably requesting time off. What recommendations would you give to managers to do that in a way and also be able to say, but you know what, we still have rules and regulations, and also obviously will depend on the organization, but just from I guess even from your opinion and from a legal standpoint, What recommendations would you give?
Yeah, a couple of sort of thoughts here. One is job descriptions are really important, right? This is why we have job descriptions, or one of the reasons why we have job descriptions, because the law does not require an organization to eliminate an essential job function, right? So the employee still has to be able to do what's essential to the job with or without reasonable accommodation. So if an employee says, if you're a Major League Baseball player and you say, I don't want to go up at bat, right? Unless you're in the American League, I mean, that's an essential function of your job. So same thing here. If you're a bus driver and you say, I can't drive, well, then there's a problem, right? There may not be a reasonable accommodation. So we're going to start with the job description. What does this job absolutely require this person to have to do? And if it's something that's outside of that, right, well, then maybe it isn't essential. Maybe we can take that small piece away. Maybe we can get help with that other piece. And even if it is essential, maybe there's a way to allow this person some extra help or ability to be able to do that essential function. So we start with the job description, and that's really important. And then I think you have to be thinking about from a consistency standpoint, what are we doing? Because, my clients always wrestle with, if we allow this for one person, what do we do when 10 more people come along behind that person and say, I want the same accommodation?
Yeah.
And that can be hard, because, I mean, if the person says, well, my accommodation is everybody else pick up a little piece of my job and we'll just share my job in my department. Well, that might work for one person, but if 5 or 6 or 7 people come up with that same plan, then people who are, there's going to be a lot of people doing a lot of people's work, right? So so we got to be thinking big picture here. Is this something that's actually sustainable? If we did it with one, how are we going to address other people who can come in and ask for the same thing?
This is outside of especially the federal government, but there was like a huge example of this in the NBA all last season with 2 players in particular. There was Kyrie Irving and then there was Ben Simmons. And, Kyrie Irving wanted to take off because you mentioned like the baseball player and the bus driver. Kyrie Irving wanted to take off from his job for exhaustion and mental health reasons and other things. And then Ben Simmons also didn't report to work for those reasons. Now, mind you, these people have unions behind them. It's totally different than working, in the office. However, not that different, because it puts the management in an interesting situation. So from a management standpoint, while we asked about management, just from if you ever get to the point where management says we can't deal with this anymore, you aren't functioning at your job, and you happen to get fired for mental health reasons, how do you protect yourself? What would be the steps for someone that may get fired? And let's just say they get fired by a manager that doesn't quite understand what's going on with you.
Right. So, a couple of thoughts. One, I'm a big believer in talking to HR, right? Like, so HR should, sometimes managers don't understand the law. That's why HR is there. If there's some sort of complaint procedure or, appeal procedure, that should be utilized. There obviously is the ability to file a lawsuit. The Equal Employment Opportunity Commission, the EOC, handles ADA complaints. Many states have their own agencies as well. I think many organizations try very hard to work with employees to resolve these issues, right? And I think, coming out of COVID, as you said, I mean, this is it's a huge, mental health is just at its, it's about as bad as it's ever been, right? I mean, with drug abuse out of control and suicides and just general stress most of my clients are short workers. So when you're short workers, that means everybody else has to work harder. So it's not just that you're short workers, it's that the stress in the workplace has gone up. So it's a tough time. And, many organizations are struggling to balance that.
Have ADA regulations shifted since COVID? Is there anything like new that's happened that does apply to mental health, especially what we've learned since the pandemic?
Not really. I mean, the law hasn't changed. I would say that, there's big questions about like long COVID and like, what is that? Is that a disability? How's it diagnosed? That's probably the biggest ADA issue that we're wrestling with. There's a lot of questions about working from home as a reasonable accommodation. And we've seen that from not just, people who are concerned about contracting COVID, but even mental health reasons, right? Like, I prefer to work from home for various reasons. Crime, right? Like it's hard. I don't want to have to ride the bus to work because it's a crime issue. Yeah. So I'm afraid to come to work. I'm afraid to take public transportation. So I want to work from home. Yeah. Working from home is there's a big push for that. Some employers are perfectly happy going in that direction. Some employers don't want to, and there's some friction there with employees that want to work from home. So, and that could be an accommodation, right? If you can perform your essential functions at home, and you have a valid request for that, then maybe the employer has a duty to accommodate that.
And I wonder how many people, it's an interesting thing. And I, as I speak to you, I realize how new all of this is, right? And how hard it is to answer, to figure out, because we're still learning. You mentioned long COVID, you mentioned, even some of the things that were well documented, alcoholism, the rise of alcoholism and such that happened during the pandemic. And even now with people, working from home, there are potential mental health ramifications that come from that as well. People just kind of sitting at home, kind of depressed, kind of, they don't have that same, hustle or bustle. They get out, they have something to do, they put the clothes on, they get ready to go. So I imagine that managers can have their hands tied because they're probably getting more time off requests. They're probably getting more mental health break requests. And then even that aspect of, you're not in the office, and this is something we've talked about on the show a lot when we spoke with management and management experts. You're not in the office. I don't know what you're doing. Some people may feel like they be maybe getting micromanaged because they're at home, and so this I guess I just wonder, like, how are management teams, HR teams adjusting while still complying with ADA regulations,
Yeah. Well, I think it's a work in progress. I mean, I think most companies are struggling and trying to adapt in, like you said, managing people who are not, in the workplace. It's hard when you don't see people every day. You don't know what they're doing. Like, you put somebody on a performance improvement plan. How do you really measure that fairly? Right. And in many organizations, you have hybrid where some people are in the office, some people are not. Some people are in 3 days, some people are in 2 days. Yeah. So, trying to treat people consistently when maybe their peer colleague is in more than you, how do you not give a preference to the person that's in the office?
Yeah.
So I mean, there's a lot of questions there as to, again, how to manage all these different arrangements fairly. The days are gone when everybody was in the same workplace working by each other. Now, Sally's working on Tuesdays and Thursdays, and Bob's working on Mondays and Wednesdays in the office, and then we have a Zoom meeting on whatever, right? So it's just it's sort of like organized chaos, and it was certainly that way during the pandemic, and people are trying to now get their arms around it. Yeah. And it's a struggle.
So I guess we'll end with this, David, as a legal expert, what recommendations, if any, that you could give to an employee that feels like, I may have to start requesting new things. I need time off that may be outside of the, a lot of time that I've been given for sick leave or what have you. What recommendations would you give an employee that knows that they're going to have to challenge their HR or challenge their management on these things?
Well, so I think talk to HR first, right? Try to work with HR. There's certainly both laws and in many cases policies that allow time off. There's employee assistance programs under many health insurance plans that have treatment types of options for people who have substance abuse or even mental health issues. So I think exhaust all those options first. And then if there's a problem where, there's a dispute over, say, time off or something like that, then, obviously at that point you need to go to a lawyer or talk to a government agency that could, provide some help there. But again, I think in my experience, most organizations at least try. And, I'm a big fan of, it's easier to take 2 weeks off and try to deal with it that way than to take, when you're in a situation where you can't come to work consistently because of mental health, or your performance is slipping because of mental health. Those are harder issues for management to deal with, because you don't know, is this person not turning their work in on time because of a mental health issue, or are they not turning their work in on time because it's a productivity issue? And that's where I see the real issues and friction with people who, maybe are not in a headspace where they are able to do their job, but they're trying to do their job anyway. And it's just not working out, and trying to separate out the performance problem from the mental health problem is just always tough for management and HR to do.
Yeah. Well, definitely a lot to learn. You're a great resource, Dave. Thank you so much for joining the show. I hope to talk to you again soon.
Sounds good. Thanks.
Thanks for listening to GovExec Daily. Our show was produced and hosted by me, Adam Butler. We want to thank David Barron for joining the program. Our music is the song Signals by Catfish Dancing. Be sure to subscribe, rate, and review on all podcasting platforms. You can email us any feedback at podcast@govexec.com or hit us up on Twitter @govexec. We look forward to hearing from you, and we'll talk to you soon.